VIPcare allows me, as a physician, to get to know my patients, get to know what's going on in their lives, everything about them, and that's what healthcare is all about. Hello, my name is Dr. William Blanchard, and I'm with VIPcare, and if you come to my office, you will receive the best medical care that you can ever imagine. I'm originally from Indianapolis, Indiana, and I've lived in, obviously, Indiana. I've lived in Montana, lived in Puerto Rico, lived in Mexico, Illinois, lived all over. I love to go to the gym. The gym is my escape. I get the lifter's high from that. That's my escape. I love to go to the mountains, the Rocky Mountains, whether it's in Colorado or Montana, Wyoming. I love to be out in nature, and I love the bitter cold. Go figure. Working in Florida, bitter cold. My grandfather was a physician in Cedarburg, Wisconsin. It was a small town, and he was the small town doctor. He did surgery in his office there because he was a physician/surgeon. And although I was a young kid, he would always talk about how patients would come over to the house, or he would go do house visits and whatnot. And I was always intrigued by that. The many things that I love most about my job is the freedom to practice my full scope. But also, I can just sit there and I can talk with my patients. On the first visit, of course, they're going to have to fill out the new patient paperwork. They're going to be triaged by one of the medical assistants. And then I'm going to go in there and I'm going to introduce myself. And I'm just going to start asking questions. I will just ask the patient, tell me about yourself. Tell me, what kind of medical conditions do you have? How many kids do you have? Where do you live? What kind of activities do you like to do? I'm more of a social physician, so I ask all kinds of questions that aren't specifically related to one condition or whatnot. That's probably the most important thing to me, is spending the time with them, because they all have questions. Every patient has a question. And if I'm there for 5 minutes with them, okay, what's wrong? Got a cough? Okay, here's a prescription. Boom, go. I know nothing about that person. I know nothing about their life, nothing about their family. So many things outside of work, outside of the clinic, are affecting their lives. So I need to know all that stuff. So that's what I like most, is I can get to know these people. Every patient has my cell number. 24/7, they can call me, text me, whatever they need. We get stuff done at VIPcare. There is virtually no waiting for things.